Hi, everyone, and welcome to Beyond Care, where we shine a light on the people, ideas, and innovations shaping the future of caregiving. I'm your host, Annika Dhariwal, co founder of Land to Care. Today, we're diving into a topic that impacts caregivers, healthcare systems, and organizations alike: how people access, afford, and navigate care in a system that often feels fragmented and difficult to manage. Today, for caregivers in particular, this challenge is even more complex. They're not only navigating care for themselves, but also advocating for and supporting others, often without the tools, alignment, or clarity they need. Joining us today is Nathan Wagner, founder and principal advisor at HealthPAT, a firm focused on transforming how people experience healthcare through patient advocacy and technology. Nathan, thank you for joining us today.
Thank you, Annika.
And I'd just like to begin by asking, how did you sort of end up being involved in the caregiving industry?
Um, Probably the same way most people find themselves as caregivers, either accidentally overnight or through a slow adoption of tasks. In my particular case, I had a background in marketing and advertising and then kind of tripped into healthcare when we moved to Arizona, and then became a caregiver when my wife was diagnosed with MS during COVID.
Hmm.
So my journey is more of a slow adoption of tasks, but ultimately, you know, uh, and everybody does have a unique and different caregiver story, but that's definitely how I became immersed in it and wanted to know more and wanted to see how I could help.
And sort of just building upon that, and like from your personal experience and in general, when we talk about sort of reimagining the healthcare experience, what does that actually mean in practical terms, especially for caregivers?
Well, let's assume there's nowhere to go but up, right? And start with the baseline. Because change and imagining anything different has to first acknowledge the problem. I can tell you just based on my experience
Hmm.
and decade of studying like just normal patient experience, some of the top complaints are access to care, time with an actual physician, costs and billing, and customer service. Now,
Right.
these can change in order based on the provider, but the basic translation is it's difficult for me to schedule an appointment. I spent 5 minutes with my doctor. I was billed $800 and nobody will return my call. So
Right.
now, on a personal level, we have plenty of things to deal with just on our own. Now, add caregivers and the whole other layer of complexity. But I also want to avoid generalizing the experience of being a caregiver because there are families dealing with dementia, with cancer, with ALS, with MS, or maybe just even the tragic result of an accident on the way home from work.
Mhm.
So, just curious to ask you, when it comes to healthcare experience for caregivers, what do you think are their top frustrations?
I would say so. Last year, I attended the HCAOA conference, and I heard a very interesting caregiver panel. It was like the five caregivers who were selected for Caregiver of the Year. And I think the biggest frustration that sort of seemed to be like the top one was lack of mental health and support for caregivers. Um, Specifically, one caregiver talked about when she was going into the home of a veteran, and he had really bad PTSD, and she actually got attacked by the person she was like taking care of. And then her agency didn't really like support her. She had to take a month off sort of for her like own mental health just to cope with what had happened. And at the same time, she was also very attached to the patient that she had been taking care of because she'd been taking care of him for a couple of years, but this was sort of a freak accident. And this is a one-off story, but I know there are many other stories like that where caregivers have very tough experiences when going into the homes of their clients, as well as even if you're just taking care of your own family member and sort of being able to like process that emotion and cope.
Yeah. Well, based on the stories that I've heard from just hundreds of caregivers and having conversations with them, is uh, number one, or in no particular order,
Yeah.
I'll put these expectations of care. So less than 20% of caregivers feel confident or appropriately trained, you
Right.
know, for medical tasks that they're going to be asked to take care of at home once their loved one is discharged. It's like, and they don't necessarily realize how much time and energy it's really going to take out of their day, you know.
Yeah. And it's sort of taking over your life. I think that expectation, it's one thing like knowing that that could happen, but it's a different thing actually living that and that slowly watching that happen. And you still want to help your loved one, but at the same time, you still got to live your life as well.
Indeed. Well, then I would add like communication and coordination because the the average American will see 18 plus doctors. 18
Hmm.
plus doctors. The average adult over 65 will have 28 plus doctors. So
Right.
that means the fragmentation of records and the scattered medical history that bears repeating at every intake and dependent for the caregiver to have to track it down whenever there's a transition in care, whether they're,
Right.
going into an assisted living or maybe they're going into a
Hmm.
SNF because there was an accident. And it's like having to kind of gather and corral all that medical record information is beyond frustrating.
And
Um,
it's just not really like organized systematically because like different people have different providers and then like different doctors have like different systems. So there's just not like one centralized way to.
100%. They all have different portals. They all have different, ways of tracking things. And, you know, I'd also say just in the way that cost and co-ownership is unequal frustration because money's not the only way to measure cost of care. It's like
Right.
time is equally valuable. So the people that have to track all this down, and spend, dealing with authorizations or, basically trying to make sure that like it can take hours to follow up with providers and insurance companies to
Right.
get that kind of authorized care. So, um, I always think that, back to your question about if there was like a practical thing that could be done to kind of
Right.
reimagine the healthcare experience, uh, I always come back to I always come back to start with a thing that we can change.
Hmm.
So my argument starts with this. I call it the three C's. So imagine a triangle, and at the top of the triangle is cause.
Hmm.
So while we can understand why people get sick and we can understand the nature of chronic conditions like cancer, cardiovascular disease, diabetes, we can't affect cause. We
Right.
can't prevent accidents that are beyond our control. We know the next virus will break out someday, but when? I mean, the best we can do is be prepared, but we can't affect the cause. So then there's the cost, the second C. Since healthcare kind of operates in the absence of
Hmm.
pricing transparency, and
Hmm.
you'll get kicked out of the club if you mention any kind of single payer system. I mean, heaven forbid, but
Hmm.
cost is just a pain that we're just dealing with and there's nothing that we can do to change it. So the
Right.
one thing that we can change is the third C, which is care. So imagine a healthcare experience where care was synonymous with customer service and helping us navigate the system. You know, how-to videos for how to do injections and wound care at home, a source of information that we could trust to point us in the right direction with the answers that we need to save time and money. This kind of change is achievable, and this could reimagine the way we experience healthcare.
And sort of building upon that from like an employer or agency perspective, what are some of the biggest missed opportunities when it comes to designing better benefits and support systems for caregivers? Just to like add upon that.
I think from the biggest missed opportunities for benefits,
Hmm.
uh, I hate to, this may sound like a tired chestnut, but Gen
Yeah.
X has kind of become the flyover sandwich generation as
Right.
employees and caregivers. Um, 15% of baby boomers still remain in the workforce, and Gen
Yeah.
Z millennials are coming up behind.
Hmm.
But there's a lot of Gen X, you know, people that are basically caught either job hugging or staying in a role that they've outgrown just because they can't move up or they're afraid to lose schedule flexibility or insurance coverage. I mean, I talk to Canadians often. about
Right.
healthcare. And while their system is not perfect, and they'll admit it's not perfect,
Yeah.
the one thing they say that gets me every time, I'm not afraid of losing my healthcare if I lose my job.
Hmm.
And I think for a lot of caregivers, for a lot of Americans, that is a true fear. And
Right.
it's the reason that, you know, I think that, a lot of people stay where they are and they don't kind of like move up. But, so going back to employers, it's like, it's kind of assumed that the second shift is just for older employees that like, and some stigma that comes from seeing maternity leave differently from, hey, making time just to move mom into the house because we can no
Hmm.
longer afford assisted living. But I'd say, honestly, the biggest missed opportunity from a practical perspective would be home health and respite care because there are absolutely volunteer coverage plans such as short-term disability that could be improved with riders or
Right.
customizable add-ons like enhanced coverage riders to like you know to increase benefits annually to help keep up with inflation or improved benefit features to cover out-of-pocket costs associated with home health and respite care
Hmm.
or expanded services to support access to mental health and then even any kind of administrative enhancement to increase the coverage period up to like 52 weeks for short-term disability. But this can be done. These benefits would just need to align with company policy.
Right. And I guess caregivers are often navigating the system not just for themselves, but also for the people they support. So, how does that sort of dual role impact their experience with healthcare and benefits?
I'd say the bottom line is this. Beyond care for episodic and acute needs, caregivers are not having a normal experience with healthcare.
Right.
They're just not. a, a dear friend that I worked with like three internets ago told me this perspective about life when things go sideways or become
Right.
overwhelming. The flood is not caused by a single drop of rain. I'll be the first to admit that being a caregiver is mentally and physically exhausting. I
Right.
mean, everything we do is out of love, but we're also like we feel caught in between those that need our help and a system that offers very little in return. Um, Aside from being like a medical power of attorney and having some level of co-management with the care journey,
Hmm.
hospitals are just discharging patients and shifting the burden of ongoing care to the home as quickly as possible, and along with anything else that might have been covered by traditional benefits.
Right.
So the caregiver is bearing this burden, and the impact on the mental and physical health is real. I mean, so while we're managing the care of a loved one, we need to take care of ourselves. And that often moves to the back burner. And that fact is supported that 100 million Americans do not have a primary care provider. 100 million Americans. So we're not taking care of ourselves. And we lack a relationship with someone who can help us with our health problems. So, and especially those attributed with obesity, stress, hypertension
Right.
that continue to skew younger and younger every year. And these can go unnoticed until the dam breaks.
And I guess sort of adding on to that, looking ahead, what would a truly aligned and caregiver-centered healthcare experience look like in the next 3 to 5 years? The most ideal system. We can dream.
Right? Um, but I think we should, because when I look to the future, I hear a chorus of voices affecting change. In 2015, there were an estimated 43 million Americans as unpaid caregivers, working
Right.
as unpaid caregivers. In 2026, that number has surged to 63 million Americans. And that also, if you did the math, that's probably 1 in 4 employees or people in the workforce.
Right.
So to provide some kind of perspective on what that, like if you were launching a brand new product, a health tech product, like a small segment audience for a niche product would be about 100,000 plus. So now imagine 63 million people. It's It's beyond that. It's caregivers are literally the fastest growing consumer segment in healthcare. Innovative products, apps, insurance plans, member-based care solutions are all going to be targeted at caregivers over the next 3 to 5 years. We are going to be their target audience as customers. But to affect change in policy, legislation, and federally backed insurance like Medicare and Medicaid,
Hmm.
we need to come together and have a voice of representation. Sadly, like every other lobbyist group, caregivers need to clearly communicate our pains, our needs, and our hope for the future. Because while we also need leaders to recognize how truly big our census is and what we're asking for can be incredibly reasonable, improving one thing can make a significant difference. But if we can line two or three things like care, systems, and solutions, then we can transform the healthcare experience.
I honestly completely agree, and especially the point about that sort of over the in the coming next 3 to 5 years, a lot of solutions in the healthcare space are only going to be targeted at like caregivers, or caregivers will be sort of the biggest segment that is targeted because just the number of people requiring care is increasing at like an astronomical rate.
Yes, yes, because I mean, in 2030, all baby boomers will be over 65.
Yep. And they're going to make up 20% of the US population.
Yes. And we're living longer and our needs are changing. Um, other staggering statistics are that, the amount of Americans that have more than one chronic illness or disease,
Hmm. It's
because
going to increase.
comorbidities tend to stack. If you're pre-diabetic, you're disposed to diabetes, and then you're disposed to potentially heart disease, which is the number one killer in America. Just the various forms of cancer. It's just alarming how fast it's growing without everything the support system needs. Like the solutions are not keeping pace
Hmm.
with the growth
Right.
of caregivers and the support that we need. And that's the part where it creates both opportunities, but it's definitely something to be paying attention to.
Yeah, I mean, it's a bit alarming as well at the same time, regardless of like how much opportunity there is in it.
Yeah.
Um,
I meant that in the way of if we're looking for innovation and we're looking for solutions, that's where we need to tackle it. It's like
right.
I'll even back that up just a little bit more and say I've been on the inside as a fractional leader in the healthcare space.
Hmm.
I've worked inside the hospital system. I see how it works. I I can tell you that we can't tell you what something costs because it depends is the answer.
Yeah.
It depends on where you're at, what's your insurance coverage, what type of coverage do you have? Are you in network? Were you referred? Is it authorized? It's it's something to where when you see the system that is in place and it's so antiquated. It's just one of those industries that, most industries kind of, they innovate and they grow. Well, I mean, healthcare is basically plateaued. They're basically they're beyond the maturity of their business model. And
Right.
innovation has to come from outside influence. Even though it has to happen inside the box because it's heavily regulated,
Yeah.
it has to come from outside. And that's why I'm saying like seeing them as opportunities to make things better and make things easier for both the patient and the caregiver and the provider.
Yeah, no, I completely agree with that. And I hope like everyone working in the healthcare industry providing these solutions kind of listens to this and just thinks about this over the coming years. And with that, it's the end of our podcast. Thank you so much for sharing your insights and your perspective. I think what stands out the most from this conversation is that improving healthcare for caregivers isn't just about systems or policies, it's about designing experiences that are simpler, more transparent, and truly supportive of the people delivering care day in and day out for years. And I think when we get that right, it won't just benefit caregivers, it also will improve outcomes for everyone involved. To our listeners, if today's conversation gave you a new way to think about access, affordability, and benefits, please share this episode with another home care leader or caregiver who could benefit. And don't forget to follow Beyond Care. Thank you for listening, everyone.